Hi, this is Tim Weber from South Texas College, and we're going to be continuing the topic of prenatal development. Actually, we're going to be picking up with the newborn, so right after that, actually. And so let's get right into it here. I wanted to have a pointer to show you where I'm at on the outlines. Let me get that going, and hopefully I can do that without. Okay. All right. So, newborn babies. One of the things that you will notice is they respond to all kinds of stimuli in their environment. For example, they're very sensitive to temperature changes. They also respond to all kinds of internal stimuli, such as hunger. So we see lots of evidence that they're processing information. We also know that they are very socially oriented. They prefer the presence of other humans to anything else and respond positively to the presence of others. And they're geared to invite care from other humans. Their big eyes and their uncoordinated movements just seem naturally designed to attract adults to interact with them and to care for them. So they're very well suited for their roles. We also will note that a number of reflexes are already active in the newborn. Reflexes are movements that are stimulated by specific stimuli, certain conditions. These reflexes sometimes have a survival purpose. In other cases, they seem to be maybe just indicators of a nervous system that's working correctly. And they have some specific purposes, helping the baby to maintain the oxygen supply and circulation throughout the body, helping them to regulate their body temperature, enable them to feed, and also, again, to stimulate caregiver interaction. So they have found also that the involvement of the father, family, and others can be very beneficial in helping the baby to get a good start in life. And here's one example. I'll explain this situation carefully because it's kind of slightly confusing. So they studied birth weight amongst infants of two groups of women, both groups of women, Mexican heritage, okay, so Mexican ancestry. Half of the women in this group were born in Mexico but lived in the United States. The other half, born in the United States, living in the United States. So all of them living in the US, but the difference being where these mothers had been born. And what they found is that there was a lower incidence of low birth weight babies amongst the women who had been born in Mexico. And so they looked for all kinds of explanations for this. And finally, the conclusion was this: people who were here as first generation immigrants tended to be more family oriented than families who had been here for generations. And so that importance of familia then to well-being came into play. And so in very traditional Mexican families, such as you might find more often in first generation families, if a woman in the family is pregnant, everyone is saying, you know, you've got to eat right, you've got to go to your doctor's visits, you have to, here, let me take that for you, you know. So there's a lot of helping out and a lot of encouragement of healthy practices amongst families, a very traditional background. So notice that, you know, family can be really important asset. They also found that fathers play a very important role. A supportive father can help the mother stay healthy and can decrease stress on the mom, because we know that when mothers are stressed, that affects their developing fetus as well. And most fathers do make it a point to be more helpful when their wives are pregnant, and an involved and supportive father also associated with fewer birth complications. So supportive fathers, very beneficial. Postpartum depression is depression that sets in shortly after giving birth. This happens between 8 to 15% of the time with new moms. Figures are somewhere in that range. So, not terribly unusual, fairly common. So, this can vary in severity from what they sometimes call the baby blues and just some mild sadness to severe, even postpartum psychosis, where there might be hallucinations and bizarre ideas and losing touch with reality. And of course, all shades in between. So, postpartum depression is serious because it can interfere with caring for the baby. And depressed moms, for example, don't feel like interacting with their baby and responding to their needs as readily. And because there's less interaction just when the baby needs this, this can even impact the baby's brain development. Also, the depressed parent might think of mistreating that infant. Yes, even going to the point where they have ill feelings towards their baby. So, pretty serious stuff. The causes of postpartum depression vary. There are a lot of factors that can come into play. And we can look at just, a basic predisposition to depression as one factor. Other factors include previous history of depression. Um, this also occurs more likely when there are difficulties with the pregnancy or difficulties caring for the baby. This occurs more often in situations where the mother doesn't have the support or resources that are needed. And interestingly, even a sense of confidence comes into play. There's one study that they did, very young teenage moms, and half of them, even before going home to the hospital, half of them got a visit from a social worker, nurse, or doctor who just simply showed them the various reflexes that the baby had. The other group, the other half of these girls did not get any such visit. And they then followed up a few weeks later to find out how many girls in each group got depressed. And they found that far fewer girls in that group that got that explanation about the baby's reflexes got depressed. And so just knowing a little bit more about their baby gave them a sense of confidence that helped them become more resistant to depression. So feeling overwhelmed, feeling incompetent, and so forth may contribute to postpartum depression. And we should also mention hormonal changes as well. Now, hormones are getting back into their other formation at this time, and that can also be difficult. So a whole bunch of things can come into play. So if we have any suggestion that postpartum depression is occurring, then it is important to intervene. And so, how can we effectively overcome postpartum depression? First of all, professional assessment. So, if we suspect that our mom is experiencing this, we need to have a professional check and see if this is indeed uh, depression. So, medical doctor, clinical psychologist, so forth. Then, if it is indeed postpartum depression, one part that's often overlooked is to simply address contributing factors. If mom is isolated, no one to help her take care of that child, then maybe it's finding someone who can help her by giving her a break now and then. If she doesn't have other resources that are needed, getting her in touch with those resources. If she is having other troubles, difficulties adjusting hormonally and so forth, then that might require some medical intervention, so forth. So identifying those contributing factors, addressing them, very important, but often sort of not done. Okay, then psychotherapy or medication also might be beneficial. Now, generally speaking, we will lean towards psychotherapy, particularly if the mother is breastfeeding, because we don't really know what those antidepressant medications are going to do with the developing brain of the baby, and they will be exposed to some of that through feeding. So, generally speaking, we're going to lean towards psychotherapy, counseling, that sort of thing. Can be very beneficial. And then support groups can be very beneficial. And being with others who are facing the same difficulties and confiding, sharing what works in a set situation where others one can interact with others, really beneficial. So ideally, all of these things should be addressed when we have postpartum depression, and if we do, the odds of overcoming it are extremely good. Next, let's have a look at the topic of bonding. And so, we're talking about bonding, we're talking about establishing a close emotional relationship with the other. Here we go. And that parent-infant bond. So, it used to be thought that early skin-to-skin contact was essential for bonding to occur. And actually, some of this came from this psychologist many years ago named Conrad Lorenz. And Conrad Lorenz did some weird experiments with ducks. And he found that ducklings would bond with whatever object they first saw when they hatched from an egg. And so, based on that, people concluded that humans were similar and had to see and have close contact with their mother, or they thought they wouldn't bond. Completely inaccurate. So, what they have found is that bonding in humans is not a one-time event, but it's rather an ongoing process that as the parents care for the child, that strong and loving connection naturally develops. Now, that said, close contact with others is important for newborns and young babies, and that physical contact actually releases hormones that are necessary for normal growth and development. Now, babies that experience birth complications, these may have lasting effects, including the need to be in the hospital for considerable time. When that happens, mothers and fathers should help with caring for those hospitalized newborns as much as possible. And here's one of the reasons why. They did studies of this technique that was called Kangaroo Care. And this was where they held these babies that were low birth weight, skin to skin, and the baby could hear the heartbeat, feel the body heat of the person caring for them. And research confirmed this was beneficial. In fact, babies that received Kangaroo Care went home from the hospital some days sooner on average than babies, low birth weight babies who didn't receive this. So this is scientifically shown to be beneficial. So massage, stroking as well also benefit with the release of hormones important for development. Now, even normal babies benefit from this as well. So important. Next, we have a look at Genetic, where are we here? Sorry. Sorry. Okay, genetic problems. So the first ones that we'll look at here are chromosomal abnormalities. So this involves then an abnormal of chromosomes more or less than is normal, less than 26 pairs. So this, in some cases, may be an inherited situation. In other cases, the cause may be environmental. Um, this is more common amongst children of older parents. The zygote must have an X chromosome in order to develop, otherwise it does not. So most zygotes with chromosomal abnormalities don't develop or will miscarry. So kind of nature's way of taking care of that. But in about 1 out of 200 births, you have someone who is born with a noticeable chromosomal abnormality, and those are the ones that we'll be looking at. So Down syndrome is also known as trisomy 21. The reason, there is an extra chromosome on the 21st pair, 3 copies rather than 2. People with Down syndrome then have specific facial characteristics that you might be familiar with if you've seen a number of these folks. And very common other deficits would be hearing loss, heart abnormalities, muscle weakness, being short of stature, slow to develop language, and intellectual disability, although not everyone with Down syndrome develops that, but vast majority. And then also accelerated aging, shortened lifespan. Now, when we meet people with Down syndrome, what we might also learn is that they're people just like us. They have emotions. They can live a very rewarding life given the right situation. And they can learn, maybe to a limited extent, with a effective educational program. They can learn some things and really get something worthwhile out of life, bring a lot of joy to other people. So we should keep that in mind. There are also genetic problems which are caused by abnormalities of the sex chromosomes. Those are the 26 pair of chromosomes. One is called Turner syndrome, where there is an X chromosome only, no second X or Y chromosome. Person with Turner syndrome will present as being female, have a female appearance, short, with incomplete sexual development, and also infertile, unable to reproduce. A particular pattern of learning difficulties is also evident, difficulties with spatial relationships, nonverbal learning, motor control, and difficulties with mathematical reasoning. Klinefelter syndrome is where you have 2 X chromosomes plus a Y chromosome on that 26 pair. This person will appear to be male, and sometimes this is not recognized until adulthood. It can vary from mild to severe in terms of how evident it is. And with this, you will see delayed language development, difficulty learning to read, difficulty with reading, coordination problems. Um, when the boy reaches the age of puberty, the penis doesn't grow as it normally would. Fat accumulates around the breast area. People, they may have not known the child has this up until that time in many cases. Now, what you should also know is that when we have these types of genetic problems, there is much we can do. Hormonal treatments can help in terms of physical appearance and that sort of thing. And specialized educational programs can help the person overcome some of the learning difficulties associated with these. So again, a person can live a very quality life even if they are beset by these kinds of things. Now, the next set that we're going to look at would be genetic disorders. So here, what we have is specific genes are involved rather than entire chromosomes. And we should know that, well, probably everybody has some abnormal genes, pretty much universal, but for the most part, they don't cause any noticeable differences. But then again, certain genetic abnormalities will cause noticeable problems. And so that's what we're looking at here. Some genetic disorders are then dominant. So if one receives a dominant gene that produces this disorder, they will develop that disorder if they live long enough. And case in point, Huntington's disease. It's a movement disorder. This particular one, dominant gene causes it. So if you get that dominant gene, you'll develop it. However, it doesn't begin showing up until people get into their 30s or 40s. So they may not know that they have it until then. That said, if you have that gene, you live long enough, you will develop it. Another example is early onset Alzheimer's. So Alzheimer's that develops when a person is in their 30s, 40s, 50. There is at least 3 genetic mutations that cause this. Can be actually inherited. Once again, if you have that gene for it and you live long enough, high chance that it develops that way. Other genetic disorders are recessive. And we already talked about sickle cell anemia in part 1, so we won't go over that again, or how recessive disorders work. Just go back there to that if you're not sure about it. Another example would be cystic fibrosis that would cause respiratory problems, or thalassemia that would cause problems with the blood. So next on our list of genetic disorders are X-linked disorders. And one of these, for example, is Fragile X syndrome. And for that, I'm going to go to the whiteboard here. So here's how Fragile X syndrome works. So it's going to affect people differently depending on whether they're male or female. So let's say you're female. Well, then on that 26th pair of chromosomes, you have 2 X chromosomes. Let's say that you inherited the Fragile X chromosome here. Okay, this one is Fragile X. Okay, the effect of this, females, 1/3, let's call it mental slowness. Okay, slow to develop intellectually. 2/3 not. If you're male, what do you have? You have an X and a Y chromosome on that 23rd pair. So if your X chromosome is actually that Fragile X chromosome, here will be the effect. 80% of males with this chromosome will have intellectual disability. I'll just put ID for intellectual disability, what we used to call mental retardation. So what you find is the effects on males is much more pronounced, much more severe, and also far more prevalent as opposed to the effects on females. So let's get your outline back up here. Okay, there we go. Other X-linked disorders include hemophilia. This is a disorder where the blood does not clot properly and can cause excessive bleeding, dangerous bleeding. Some types of color blindness. You have male pattern baldness and things like that. So there's a number of these. Now, prenatal testing can be done to have a look at the health of the fetus. And so here are some things that can be done to evaluate that. And one would be simply family history. So is there a family history of any genetic disorder? The alpha-fetoprotein assay is a blood test that is done that looks for abnormal proteins. These may indicate anything from Down syndrome to multiple births, so they're not conclusive in terms of exactly what is going on. We have the ultrasound or sonogram, and this we can visually see the developing fetus, whether all the arms and legs are there and things like that. Amniocentesis is a procedure where a needle is inserted into the womb and draws out some of the fluid. Again, they can look for genetic abnormalities there. Chorionic villi sampling, similar to amniocentesis, although done vaginally, can be done earlier. Is kind of the advantage there. Now, when it comes to amniocentesis, alpha-fetoprotein assay, alpha-fetoprotein assay produces significant numbers of false positives. In other words, suggests there may be a problem when in fact there isn't. So when there is a positive result to the alpha-fetoprotein assay test, this should be retested again later on with with other types of testing. Also, the person receiving a positive to that alpha-fetoprotein assay should be told that it does produce significant numbers of false positives, suggesting there is something wrong when there isn't. Unfortunately, that's not always communicated, and I've had students that they have told me when they received their alpha-fetoprotein assay, when they were pregnant, the doctor told them, oh, it's a positive, you're going to have a child with Down syndrome. And in fact, they went through with the rest of the pregnancy, and in some cases, there was no Down syndrome. So people should be educated that this can produce false positives and should be looked at again later. It may be nothing. So all of this also brings up the whole question then of genetic counseling. So sitting with a genetic counselor is recommended when a woman or couple has a close relative with a serious genetic condition. Also, if they have a history of miscarriages, stillbirths, infertility. If the couple is from a small ethnic subgroup or is blood related, okay. Now, you might wonder why that. If you are from a very small ethnic subgroup and you are reproducing within that group, if there's any genetic abnormalities within that group, you are more likely to encounter that than in a larger, more diverse population. Also, this is recommended when the female is over age 35, the male over age 40. So what is the purpose of genetic counseling? Well, if there are any things indicated that of the possibility of a genetic condition being inherited, then this helps the person, the woman or the couple, to evaluate that, potentially to prepare for that, okay, or to decide what steps they will take as a result. Now, who makes decisions when it comes to an indication that there might be some genetic abnormality? Does the genetic counselor make the decisions? Does the doctor? No. The woman or couple makes that decision as to what to do. The genetic counselor's role then is to educate them about what the results of various tests mean, about various options that might be available, and then help that person or couple work through the decision-making process without influencing their decision, which can be very difficult in many cases. So now let's have a look at prenatal teratogens. So these are substances, conditions that can impair prenatal development and potentially result in birth defects or even death. Not all of these teratogens can be completely avoided. However, if one is aware of them, one can take reasonable steps of avoidance, and most of the time, the outcome is just fine. So these teratogens then may produce structural abnormalities, abnormalities in the formation of limbs or organs or body parts, or they can be behavioral teratogens that affect the child's developing brain. In this case, they might cause developmental retardation, hyperactivity, learning disabilities, or neurological problems. Often the effects of behavioral teratogens are not immediately evident in the weeks and months after a baby's born, maybe not becoming evident until they get a bit older and they're at the age when they're getting into school in some cases, although often there are indications sooner than that. So we're going to look at, what factors determine whether these teratogens actually produce damage or end up being harmless. So one would be genetic vulnerability. So certain genes increase vulnerability to certain teratogens. One example of this, neural tube defects. So these are where the neural tube that becomes a spinal cord and the spine doesn't develop correctly, such as spina bifida. This doesn't develop properly, and therefore this can result in movement problems affecting the child's nerves and many other things. Now, what they found years ago, they found out that folic acid deficiencies increase the risk of neural tube defects very significantly. And so at that time, what they did is they began adding folic acid to just commonly consumed foods. So wheat flour and things like that. And lo and behold, the numbers of babies being born with neural tube defects did decrease very significantly. However, they subsequently found that, in fact, the amount of folic acid that was obtained through that supplementation in just commonly eaten foods was not enough to prevent this in some cases. Turns out that due to genetic differences, some women don't metabolize that folic acid as well as others. Some, because of these genetic differences, needed higher dosages of folic acid. Well, that's where things like prenatal vitamins come in. So notice that, genetic vulnerability plays a part. Now, also, the timing of exposure to that teratogen matters as well. So if it occurs during a critical period of development, when a particular system or body part develops and must develop during that time, then this is particularly destructive. So for structural abnormalities, exposure to certain teratogens during the first 2 months of pregnancy can cause damage. This is also the point where many women don't yet know that they're pregnant, and when many miscarriages occur. So that suggests that it's important women who might become pregnant take steps to avoid teratogens so that if unknowingly they are pregnant, that this won't cause damage to their child. Now, exposure during sensitive periods can be damaging as well. Teratogens at this point can interfere with the further development of established body parts or systems. So if you have a look at this chart here, you'll notice that on this chart, we're looking at development week by week here for the first 8 weeks. And notice it's then jumping 9, 16, 32, 38 weeks here. And the chart tells us when various systems are in their critical or sensitive periods. The pink area is critical period, and purple is the sensitive period. Notice the central nervous system is actually vulnerable throughout pregnancy. And early pregnancy, yes, critical period can have some very serious effects. Even the last weeks of pregnancy, exposure to certain teratogens might cause things even like learning disabilities. Also notice that early on, development of the heart, arms, legs, and so on, lips, ears, eyes, and so forth is going on. And so damage at that time can have very significant structural effects as well. So once again, this all points up the importance of being prepared for pregnancy, taking steps to avoid those teratogens. Third factor that influences whether a teratogen will actually cause harm is the amount of exposure. You might call it the dosage. Now, with some things, this exhibits a threshold effect. An exposure to that particular teratogen is harmless unless the exposure exceeds a certain level, but below that threshold is not damaging. So some cases in point here. We have bisphenol A, BPA, which is used in making certain clear plastics. So small amounts of this seem to be harmless, particularly for adult humans, but we don't really know exposure levels, threshold levels for developing fetuses. So in this case, knowing that it can cause harm in very high amounts, avoidance of this while pregnant may be advisable. And in fact, now if you go in the store to buy water bottles and things like that, you might see some of them will say, what, BPA free? Yeah, so that would be important to look for those if one is pregnant or potentially might become pregnant. Also, the amount of exposure in terms of drugs can make a difference. And so some medications can be tolerated without any problem below a certain dosage level during pregnancy. Above that level might be damaging. Now, with drugs, we should also recognize that there can be an interaction effect. And so if more than one drug is taken at a time, their effects may become much more damaging, much more readily. For example, alcohol can be damaging to the fetus if taken prenatally. So can tobacco. When they're ingested together, the person is using both, they become even much more likely to create problems because they interact with one another. So if you, for example, let's say that you're a chemical dependency counselor and you have a woman in front of you who is pregnant and uses both alcohol and tobacco. One of the first things you want to do is try to get them to at least quit one and eliminate this interaction effect because it's so significant. So at least you want to get them off of one of those. Now, ideally, you'd want to get them to quit both, but in fact, you may have to work first for one and then the other. Now, here's an interesting one. Vitamin A can be a teratogen, and mega doses of this can damage the eyes of the developing fetus, things like that. But notice, yeah, some of it's necessary. So notice more is not always better. And so reasonable doses of nutrients is important, but mega doses, not necessarily good. Fish. Now, fish is generally a pretty nutritious kind of food. However, there have been some pollutants that have been discovered in fish. And so when pregnant, overconsumption of fish is to be avoided. And so they will recommend maybe fish once a week and then rotate the source of the fish so that if there is a pollutant, that it's not the same one being encountered over and over again. So just a little aside to talk about fetal alcohol syndrome. So that can occur in babies of women who drink significant quantities of alcohol while pregnant. You'd see abnormal facial characteristics, slow physical growth, impaired mental ability in victims of this. And so maybe you're thinking, well, gosh, maybe we ought to have some special laws against prenatal drinking. Would that be helpful or would that be harmful? On first glance, you might think, well, that should be helpful. Maybe that would prevent this. Well, maybe it would, but also consider what happened in a similar situation. One state, they enacted some special laws with stiffer penalties for women who were found to be using cocaine when pregnant. And did this decrease the number of pregnant women who used cocaine? Unfortunately, it didn't. What happened is women who were using and were pregnant simply avoided prenatal visits where that might be detected, and avoiding those prenatal visits was a very significant negative when it came to health outcomes for their babies. So, in fact, this didn't help. It actually was more harmful than helpful. So, if special laws against these types of uh, practices are not helpful, well, what can we do about that? Well, for one thing, we can educate people, okay? And that might take showing them what can happen if they, for example, engage in excessive alcohol intake while pregnant. And uh, educating, important, and then also making rehabilitation readily available for women who maybe do have a problem with a drug addiction or drug dependency and become pregnant, and rehabilitation to help them then overcome that. So we need to work for our insurance and government programs making the education and the rehabilitation available. So just to kind of then sort of try to sum up a bit more on this, let's just go to this chart. You'll find something similar in your textbook, and we'll just talk about some very specific teratogens in more detail. Oops, there we go. I guess I can't make it too much bigger. So, all right, teratogens, one category would be various diseases like rubella, the measles. Now, mostly that's been wiped out due to immunizations. But notice that back in the days before immunizations, this caused a great deal of damage to unborn babies. So that also should suggest to you that we need to continue to get those immunizations so that this disease doesn't begin to pop up again, as it will. Toxoplasmosis is another teratogen. It's a uh, bacterial disease, and that bacteria might be encountered in, say, uncooked meat or cat feces, and so they will suggest that women maybe avoid handling dirt that might be used by cats for litter box, that sort of thing, and eat fully cooked meats while pregnant. Avoid that. Infectious diseases like influenza, chickenpox, measles. Again, we don't worry too much about measles and chickenpox because generally speaking, we don't see it around. But if kids don't get immunized, those things are going to start popping up and they can be very damaging. Um, in this category, too, um, our most recent coronavirus, we don't exactly know. Now, it seems that the effects of this being passed to a fetus or a very young child don't seem to be too significant in most cases so far. But with more research, we might find that there is harm that comes maybe later on that we didn't know about. So obviously avoiding passing that on if we can. Then we have sexually transmitted diseases of various types. In general, if there's any possibility that a woman might have these, it should be detected and should be treated before becoming pregnant. Now, in the case of HIV/AIDS, this one can be passed on to the fetus. But that said, uh, various drugs to treat it and delivering the baby by cesarean make it rare that AIDS is actually transmitted from mothers to babies today. That said, if a potential mother is infected with HIV, they might want to think twice. Um, what else? Variety of other infections, again, should be treated preferably before becoming pregnant. All right, pollutants, things like lead, mercury, PCBs, might be worth noting that even pesticides, herbicides can be problematic, cleaning compounds, especially the more powerful ones. So generally just avoiding them as much as possible. Washing fruits and vegetables, avoiding those chemical compounds, and so forth best. Radiation. So the primary concern here, the most common exposure to radiation that people might get would be from X-rays. So during the time of pregnancy, then other types of lab tests like sonograms should be used rather than X-rays. Social and behavioral factors, high levels of stress. That's why it's important for women to get adequate sleep, relaxation, so on. Malnutrition. So obviously a balanced diet is important. Prenatal vitamins. Excessive and exhausting exercise because it may interfere with the delivery of oxygen to the fetus. So in this case, it's recommended that women get regular exercise, but of a moderate sort and generally consistent with what they were used to before becoming pregnant rather than drastically increasing their level of exercise. Then we've got a whole list of medicinal drugs. And if you look at this, several of these are antibiotics that are commonly used and can cause some maybe unexpected problems. And I want to point that out because, because we live right here along the border, I think a lot of times, if you come down with a little something and you think, well, maybe an antibiotic would help, instead of going to the doctor and having them prescribed, you might just take a little skip across the border, go to the pharmacy down there and pick up some antibiotics and take them. You might not know if you're pregnant that could cause some problems for your baby. So have a look at those. Now, really what we need to do, taking any medications, is have the doctor evaluate that before becoming pregnant and adjust those medications for safety, or maybe discontinue or substitute others in some cases. On this list, we have psychoactive drugs. Now, caffeine, many people worry about that, but typical use of it, not a problem. That said, they'll say, well, what do we mean typical use? 3 cups of coffee a day or somewhere thereabouts. That said, if a person is drinking huge pots of coffee and so on, that could become problematic, but normal use seems to be no problem. It's below that threshold effect that we talked about. Alcohol, we talked about fetal alcohol syndrome, or a milder version, fetal alcohol effects. So what you should realize, a woman has a glass of wine or something like that while pregnant, odds are highly unlikely that that's going to cause a problem. On the other hand, if the alcohol consumption is chronic and constant, the potential of damage increases significantly. What's really a concern, though, is binge drinking. 3 or 4 more drinks on one occasion seems to be even more dangerous. Tobacco, one of the problems here, reduces birth weight, increases the likelihood of low birth weight baby, also has effect on the development of lungs. So one is a tobacco user, quit smoking before pregnancy and during is best. Marijuana, what they think is maybe very heavy exposure to this during pregnancy might have some effects on the development of the nervous system. So maybe better to save that for times other than pregnancy. Heroin, cocaine. Here, one of the biggest problems with these is that the baby may be born with an addiction, a dependence on these drugs, and will have to go through withdrawal, which can be life-threatening for the baby. So obviously, if one has a drug dependence problem before pregnancy, is the time to take care of that and get some help getting off drugs rather than waiting for that. So a whole bunch of stuff there. Now, we're not putting that all there to scare you. If you take reasonable precautions, 99.9% of the time, things will be fine. And in fact, prenatal education is important because that lets parents know what they can do to be safe, reduces anxiety and stress, which is important. And good prenatal care then helps women have healthy babies, saves lives, reassures parents again that they're doing the best for their child. So here's a list of recommendations for women that are pregnant or may become pregnant. One would be to plan the pregnancy, prepare ahead of time, take a multivitamin with folic acid, and then avoid binge drinking, quite obviously. Update immunizations before becoming pregnant. Gain or lose weight as appropriate. So what they found is being within a normal body weight is most advantageous. Women who are underweight or overweight are more likely to have babies with birth complications. So, by the way, that also means during pregnancy that one should expect normal weight gain during pregnancy. Also, reassess the use of prescription drugs before becoming pregnant. Those may need to be changed to other medications or discontinued. Then maintain exercise habits. So, some moderate exercise, whatever one is already used to during pregnancy. Adding to that, identify and treat any detrimental diseases before pregnancy, avoid known dangerous substances, get adequate rest, relaxation, and sleep, and eat a balanced diet. And that should pretty much round things out. And so there you go. There's a list. Okay. And we're going to call that it for today. Sorry about some of the technical glitches. So that's it. Have a great day.